This is the intervertebral disc. This is the intervertebral disc. It works as a shock absorbent. Like you have soft heels, you have cushion giving heels in the running shoes. Similarly, God has given us some shock absorbent in the body. As
So is it like the meniscus in the knee, Rajat?
exactly. So meniscus is like the intervertebral disc in the knees between the fibula, tibia, and the between the upper leg and the lower leg. Inside the knee, there is a meniscus which works similarly like an intervertebral disc. So here also, do you see how there is a layering on the outside? Like there are in a tree, when you cut a tree into half, you can see similar layerings in the trunk. Hmm? These is known as annulus fibrous. Annulus fibrous. Can you say this? Annulus fibrous? Annulus fibrous.
Nucleus
Annulus
fibrous.
fibrous.
And inside there is something liquid, see, semi-liquid, I would say. This is the nucleus pulposa. Nucleus pulposa. The name
Pulpy.
itself, the word nucleus, very much tells that it is something in the center, the nucleus. And pulposa, remember the word pulposa sounds like pulp, something pulpy, something like jelly-like texture. And fibrous means something like a fiber, some fibers which is protecting that nucleus. So whenever we go through some wear and tear in our life, whatever maneuvering we do, walking, running, hunching forward, lifting up weights in irregular patterns. So slowly, these layers of the annulus fibers will start cracking. They will develop cracks in it. Hmm? That is the first stage that the pulposa is under threat, that the entire disc might go through a disc bulge. And once the crack will develop, what happens one day you will lift up a sofa or some crooked movement, and suddenly the nucleus pulposa can pop out from the disc. If this pops out, we call it a slip disc, but the slip disc is a very false kind of a word. We will say it a herniated disc. Because the disc won't slip out. The disc is only there. It's still there, but it is just that the annulus fibrous will suffer a wear and tear, and there will be a vulnerable spot somewhere, which is mostly to the posterior compartment. Most of the slip discs will happen to the posterior compartment, to the backside. And there is a reason behind it. We'll see it in today's class. And sometimes when this bulge will come out, something like this, it will unnecessarily irritate the nerve that resides here, or maybe the nerve that comes out from this foramen, from the intervertebral foramen. This is the intervertebral foramen. We saw the yellow shaped nerves coming out, right? So what is a slip disc? See, so these are the discs. These are the discs here. Can you see the discs here? This is the disc. This jelly kind of a structure is a disc. The white structure is the vertebrae. The yellow structure here are the nerves originating. See, inside you can see the central nervous system. Inside you can see the spinal cord. Hmm? And this hole here is the intervertebral foramen. And what happens? They have shown a slip disc here. See, do you see this red colored bulge here? This is a slip disc. So sometimes the disc will herniate like this, most often which happens to the posterior compartment. This will unnecessarily pinch or press on to a nerve that is coming out from that particular foramen. Or it can also press to the central nervous system. There are some nerves that come out from here and go all the way down from our buttocks till the heel, from the calf along. If that nerve is being pinched, we call it sciatica. Then we'll say sciatica nerve is being pinched. So there is a specific word in medical science whenever a herniated disc pinches or irritates an originating nerve from the intervertebral foramen. This is known as radiculopathy. सागर स्पेलिंग आप भेज देना इनको, हाँ, radiculopathy. So radiculopathy, if the radiculopathy is happening in the area of the cervical vertebrae, what happens is that tingling in the fingers. The patient will complain, maybe I can't sense my little finger. In the tips of my fingers, I have certain tingling happening. If it is unnecessarily pressing on to some nerve that innervates to your brain or maybe eyes, then they will say that we can't see from one eye. Or maybe I get dizzy whenever I twist. I'm riding a scooty, when I look back, I suddenly feel dizzy, or I can't see, I'm blinded in one eye. So there are nerves that innervate to different parts of our body, and sometimes they can be impinged because of that herniated disc. So the discs, remember, is an avascular tissue. It means that it doesn't have a direct supply of blood. So whatever nuclei you have inside it, it's the food for the disc for the entire life. Once you start losing it out, then you can't, rebuild it again. Very minute amount of that reconstruction will happen, but it's just like, you by the time your lifespan ends, it will still won't heal up. Hmm? It won't heal up. So we might need like 2 3 lifespans to recover the same disc, but that's not possible. It's just like when reptiles lose their limbs, they can still grow their limbs. If a lizard loses its tail, it can regrow the tail, but humans can't do that.